We're going to talk about a full physical examination on a canine. The reason we do this is because it's good to know the normals so you can recognize the abnormals. So one of the first things we look at is their attitude, bright, alert, and responsive. If they're not, they might be quiet, malaise, not working well. Then we're going to look at their hydration. So we check the moistness of their mucous membranes. Sometimes if they're panting, their mucous membranes on the side will be dry, so make sure you check under the nose. So they should be moist, a nice pink color, and when you press it, the capillary refill time should come back in less than 2 seconds. You can also ask the handler if they've been urinating normally, because like humans, dark concentrated, infrequent urine may be an indication of dehydration. The other hydration check is on their skin. It should bounce back really quick. Another indication that they're well hydrated. Up. So after we've checked their hydration, we're going to check their eyes, ears, nose, and throat. The eyes should be clear, no discharge. You can check the conjunctiva, make sure it's nice and pink and not too red. You can also check their pupillary light response. Just like humans, there's a direct and an indirect. So you can shine it on one and shine it on the other, and your direct and indirect response can be recorded. So eyes, the ears should be nice and clear and clean, no malodor. Sometimes if they're shaking their head a lot or scratching at their ears, they may have the beginnings of an infection. Their nose should also be nice and symmetrical, no discharge coming out of it. The nose, of course, a very important part of their search. And then you want to check their throat. Make sure there's no foreign bodies back there. They can have swollen tonsils as well. So there is a spot right behind the canine here. It's very sensitive. It's a space on a gum here. And if you press on that, they should open their mouth up, and you press down and you can take a nice look inside their mouth. Again, that's a spot over here. If I press up there and down there, I can get a nice look inside their throat. The next thing we're going to check is their heart and lungs. So their heart, we'll listen with the stethoscope. Up. And you want to go right behind the elbow. That'll be about the 4th to 5th intercostal space, and down about 1/3 at the bottom of their chest. It's ideal if they're not panting, so you just want to close their mouth for a moment and you'll get the heartbeat. The heartbeat averages, like humans, 80 to 100, but they're very athletic dogs. So often they'll have athletic hearts, and their heart rate may be as low as 50 to 60. At the same time I'm listening to the heart, I want to check the pulse, which is inside the thigh in the back here. So while I'm listening with my stethoscope, oftentimes my hand is right under their thigh. I want to make sure their pulses are strong and synchronous with the heart. Not having a synchronous pulse may indicate VPCs or PVCs, if you say it that way, ventricular beats, and it could indicate an abnormality. Then I want to listen to their chest, their lungs. You're going to listen to an area behind their upper arm or their elbow, and just actually follow the ribs. And you can do different quadrants. Again, it's ideal if they're not panting. Hi. Just a little quick there. Wait till they take a breath. And then we'll do the other side. They also might have enlarged lymph nodes, especially if there is an inflammation or infection. So the lymph nodes they have are right underneath the jaw here, right in front of the shoulders here, and then I slide back here inside the flank, and then actually they have them right behind the knee here. If you don't feel anything, that's normal. But if there's an infection or inflammation, and that's the lymph node draining that area, that might be big. The next thing I want to check is their abdomen. If I press up on the abdomen, it should be soft and non-painful. Yeah. Skin, of course, is a very big thing. Oftentimes their fur will hide a wound, but you can look for wet spots, certainly bleeding, or if they flinch away when you touch them. That might be a little painful and indicate a wound underneath the fur. One of the most common places to get wounds are the limbs, belly, and paw pads. Now, if they have a wound on their paw pad, they'll probably be lame, so you might be able to pick that up on the orthopedic part of the exam. But checking paw pads in search dogs is extremely important because it's one of the most common areas that they'll get wounds, abrasions, lacerations, puncture wounds. And if they're standing, the way to do that, is to put their paw to the back of them, kind of like you do with a horse. And you can take a look at each of their digits and the webs in between. For the back legs, sometimes I give them a little help here under their belly, and I will also go to the back here and take a look. Don't lift it too high, it is uncomfortable. You can stay low, and that's how you check their paw pads. The last part of the exam is really orthopedic and neurologic. Neurologic, we don't go into details unless they have a suspected paresis or paralysis. But the orthopedic, often the handler will come up to you with a complaint of a lameness. If you watch them walk, they should be nice, strong gaited. But if they have a lameness, then you can look at that specific leg. The final thing we do, which is the most uncomfortable, is take their temperature. I don't always take their temperature if they're not sick. Rectal temperatures are the way to go. They do have a higher temperature than humans, averages 99.8 to 102.8. Search dogs, especially when they're very high drive, may have temperatures of 103 or 104, even 105, and that may be normal for them. If they're feeling ill or they're not searching well and there is something wrong, it is important to take the temperature, but I usually do it just if there's a problem. They do have thermometers that will take a temperature in the ear. Some of them aren't very accurate, others are. They're still working on the accuracy of those, which of course would be much less stressful for the dogs. But if I am going to take a temperature, I usually save it till last because it's one of the most uncomfortable things that we do when we do a physical exam. And we're going to go over restraint to show you how to more easily assess a lameness. And that's our physical exam.